Thank you so much for being here today. We're going to get started. So, welcome to Third Floor Views, a production of Chesapeake Family Life, where we talk about health, education, and living with kids. I'm your host, Janet Jefferson. Here with us today is Dr. Stephen Labbe from Labbe Family Orthodontics. Thank you for being here. Dr. Labbe, originally from the New England area, has been living and practicing in Maryland for over 30 years. He lives in Annapolis with his wife and 2 children, and when he's not creating beautiful and healthy smiles, he's managing 4 location practices with 30 employees. To our viewers today, please feel free to submit any questions or comments in the comments section, and we'll try to get to as many as we can. Let's jump right in. So, Dr. Labbe, while the pandemic has impacted everyone, small businesses have really been hit the hardest. So first off, how are you and your family and your work family doing right now?
Hi, Janet. Thank you for having me. My wife and I love your publication. It's so community oriented, and it's my honor to get to talk to you today. So thank you.
Absolutely.
We're all doing well. I have an 18 and a 20-year-old home. My son's finished his finals, first semester freshman at University of Tampa. And, the online learning was a challenge for everyone. But my daughter just finished her last final yesterday. So they're both happy and we're healthy. So that's all good.
Yeah, that's a big deal. Yeah, I'm sure doing finals and finishing, especially for freshmen, their first semester, that could be really tough doing that online. But everyone's healthy, and that's really what matters. How about your work team? How are they holding up? I know that this has been challenging for everyone, sort of mentally and emotionally. And you guys haven't been operating like you used to. So how is your work team doing?
The work team is doing well. It's been, as you said, challenging and frustrating for everyone.
Yeah.
A lot of confusion, but communication is key. And I think that throughout this, I've tried to communicate with the team at first how we were going to handle employment.
Mm-hmm.
Most everyone, but a handful of people that helped with some answering of telephones for emergencies and such. Well, let's say when we first closed, it was only going to be for 2 weeks.
Right.
The mandate. So, what are we going to do with 2 weeks worth of patients, which soon became much longer.
Right.
So most of the staff hadn't seen each other in a while. We started having Zoom meetings to tell them how we were going to approach this. Right. And the information was taken from Zoom meetings and webinars of, large accounting firms that we were following, and we would communicate that information to the patients, to our practice, to our staff members via the Zoom meetings. And those Zoom meetings sort of became Zoom happy hours, but it was great to see everyone online and, just to see how they were interacting after not having been with each other was a pleasure, because they really do love each other. And, it's more than just a workplace. It's really a family.
Yeah, definitely. I think we're all feeling that right now, is really missing that community and missing each other and having those interactions. And so Zoom does sort of fill a bit of a void, but it's not quite the same. So let's go back in time a little bit. Can you tell us a little bit about how you decided to close? Because you were sort of one of the earlier businesses to decide to close. So what was happening during that, and how did you make that decision?
So my wife, Stacy, and I were traveling at Laguna Beach, California for a dental meeting the week of March 13th. And we returned on the 15th, and we were putting a plan together as what this week was going to look like, because the talk had started to become, coronavirus oriented. Mm-hmm. And we were starting to put measures in place, like take away the coffee station, take all the magazines out, put signs up on how to wash properly, and trying to do everything we could to focus on this what was going to be the new norm. Mm-hmm. And we worked that next day. March 16th was a Monday. My first day back to work was a 12 noon to 7 p.m. day. And at around 2 o'clock, I happened to check my email, to find out that one of the speakers at the conference that I just had been to had tested positive for coronavirus. So all of a sudden, it was here.
Right.
And I walked out to my car, sat there, and I just thought, now this email said that, you've been possibly exposed. I personally know that I was talking to the gentleman. He signed, autographed his book.
Oh my gosh.
We were right on top of each other. So
right.
I called the office and they said, Dr. Labbe, where are you? And I said, I'm in the parking lot. Why are you in the parking lot? I said, because I'm going to self-quarantine. This has happened, and I explained it to them. So they canceled the patients, and we went home and for the rest of the day started planning of what those next 2 weeks were going to look like.
Mm-hmm.
And by the next day, when we heard that the governor was closing down, we then started planning, that everybody was going to be closing.
Right.
So,
right. Yeah, that's crazy. But luckily you're healthy, right? And everything.
Yes. We ended up,
out.
after the initial 5 days, there were no symptoms.
Mm-hmm.
And then 14 days later, I started coming in with one other dental assistant, starting to see the emergencies that were calling in with a broken bracket or a pokey wire.
Mm-hmm.
And interestingly enough, the recommendation was try not to have them in the office if it's at all possible. So they would pull up and I'd put on, the gown, a shield,
Uh-huh.
the masks, come out there, and they'd roll the window down and I'd reach in and clip the wire and off they would go. Within a minute, we had fixed the problem and they had never even entered the office. So we didn't have a lot of cleaning up to do or, decontamination.
Right. Literal drive-by dentistry.
Yes.
So how, since you are in the medical profession, you are always aware of how, germs are spread and making sure that you're protecting yourself. Have you found a lack of protective equipment, or do you feel like you've been pretty well stocked and that hasn't really been a problem?
No, it was a problem. Fortunately, with 4 locations, we have a pretty good stock as it is.
Mm-hmm.
Having practiced for 30 years, I've lived through AIDS and SARS and different things. And they've always trained us to say, the patient will only communicate a certain amount. They fill out the medical questionnaire. They may or may not be honest. They may not know that they have something. Treat
Right.
each individual patient as though they have an infectious disease.
Mm-hmm.
So, for years you wear mask, protective goggles, gloves, hand washing, all the basics. But now they've added stuff like, putting a shield in front of your mask.
Mm-hmm.
And they've improved the mask. We've always had a level 3 mask, which is a nice surgical mask, protective, but now they have N95 and KN95 masks, which are even, filtered even more.
Mm-hmm.
So those things that we hadn't, the things that we introduced were hard to get. And I had a team of staff members working diligently to find, these different PPE, personal protective equipment that we needed for whenever it was we're going to reopen. And again, it's one of those unknowns. We had no idea when we were going to reopen, but we decided to try to be as prepared as we could for what that day was going to be, thinking maybe it's middle of May, maybe it's June 1st. And then when Governor Hogan said May 7th, that was a little bit of a shock. But we scrambled. We didn't open right away because we weren't prepared, as we were still getting the supplies that were difficult, to answer your question, to get. But eventually we had everything we needed. We had sneeze guards up at the front desk, and we started this week seeing a patient per hour, plus 1 new patient in the morning and 1 new patient in the afternoon. So this week I worked seeing approximately, 8 to 12 patients for the whole day. So there may be 1 or 2 patients in a 4,200 square foot office at one time, and we had the parents waiting in the parking lot.
How would that be different, say, from what you were doing, 3 months ago? How many patients would you see on an average day?
A traditional orthodontic office works in an open bay. I've got an island with 6 chairs around it. The adult area has another 2 chairs. I have a couple consult rooms. So, in my practice, our office with 4 locations, we could see 65 patients in a day. There are some practices that see 200 patients in a day.
Wow.
But to go from even what we were doing, 65, to seeing 8 patients is a big, big difference.
Yeah. Yeah.
And come June 1st, we'll probably see half of what we did before. So this was sort of a soft opening, sort of a trial, sort of a, see how the patients feel, make sure we have all our ducks in line, and then come June 1st, we'll have 4 assistants working instead of just the 2 I had working with me this week.
Okay. And what are some other adaptations that you guys have done to be ready for June 1st? So what is that going to look like? So other than cutting back on number of patients and having sort of an in-between number of personnel, what are some other things that maybe have changed?
So in addition to the layout of the room, it is, sort of an open room. And as I said, we're going to have, we had 6 chairs around an open bay. So the idea is, if we work in chair 1, 3, and 5, you've got 3 people spread out with 10 feet in between each. Instead of using 6 chairs, we're doing 3 chairs. So there's the social distancing. When they drive up, we have implemented through our software management system, Dolphin, something called My Orthodontist. So they download an app to their phone, which virtually puts the practice in the palm of their hand. What they can do is they can access all the forms that we put online, the health questionnaires, the pre-screenings. They can check their appointments. They can check their balance. They can look and see pretty much anything that we were doing face-to-face. Now they have it in the palm of their hand. So they drive into the office and they let us know they're here. And then we have the parent and the patient into the vestibule area where we take their temperature. That's something new. We wouldn't have to do that before. And they answer the pre-screening questions. And if they're healthy, they're allowed into the clinic and the parent goes back into the car. So there's really no reception area any longer. It's there, and we have certain chairs that they can sit in separated. So like the virtual world, right?
Right.
Okay. And another thing that we implemented was, there were a lot of webinars that we watched during this downtime and trying to learn. And let me back up a second and say that teledentistry has been, out there for a few years now, but somebody like myself really didn't move in that direction. And this pandemic really was a kick in the pants to say, this is something that you can utilize so that you can communicate with your patients. If it's a new patient, they have the company we ended up going with, Dental Monitoring, has something called SmileMate, which is a virtual consultation. So you take some pictures of your teeth, you send it in, I look at them, analyze what I can tell by pictures, and then we have one of these meetings and we just discuss, your treatment as though you were in the office. And it really allows us to determine, if you're a candidate for Invisalign, clear aligner therapy, or for braces, and what your level of interest is. And then when the office reopens, you come in and get a full set of records, and we get started you in whatever treatment best fits your case.
Do you feel like that virtual interaction is an acceptable replacement for being in person? Or is it just because it's preliminary, it can sort of get the ball rolling in a safer way? Are you happy with how that sort of virtual transition has gone?
It's a great question. It's going to take some adjusting for everyone, but I think that whether the consumer's mindset or our patient of today is different than when I started. Patients want ease of access. They want convenience. And for certain patients, this is exactly what they're looking for. And, it's interesting that you say, is it the same? It's not the same from a personal,
right.
But,
Sure.
From a scientific approach, some of the artificial intelligence that this company uses to determine, let's say, for a clear aligner patient, for Invisalign, if they're wearing an aligner and they're supposed to change after a set amount of time, 7, 10, or 14 days, when they come in to see us after, say, 8 weeks, we'll look at their aligners and we'll determine if they're ready to move on to the next aligner. How did they do with the batch that we gave them while they were away from the office? Now, in an 8-week period, that's 2 months, they'd send us pictures. Let's say if it's even twice a month, then there'd be 4 touches in the time where we had in person 1 touch.
Gotcha.
So, it's less personal, but in the long run, it may even work out better in terms of tracking their case. Now, with braces, it'd be a little different. They can still start sending in pictures of their teeth, and we can check how their hygiene looks, what's the health of their teeth and their gums. Is there anything broken? But they still have to come in to get an adjustment.
Right.
So the dental monitoring, the teledentistry, the virtual tracking of the patient, it works better in my mind for the clear aligner therapy, because you can give them more aligners that they just switch out, and they don't have to come back in for a new scan until they've completed that batch of aligners. Whereas with the braces patients with fixed appliances, they have to come in at some point, even though it's nice to see where they are along the way. It's not going to save, say, office visits like it would in the other. But what I want to see in the long run with either is if it's going to help efficiency in terms of, if we say that your treatment is going to take this much time to finish, that it would finish on time because you're being more diligent compliance-wise, because you're sending photos of your teeth to me twice a month, whereas before you were only coming in to see me after 2 months. So a lot can happen in that 2 months where you might have gotten off the track, but having to touch base, even if it's virtually, with an email or a phone call, that we've looked at your pictures twice in a month instead of once in 2 months.
Right. Maybe you'll have higher accountability of your patients.
Have higher accountability and a better tracking, and your case will finish on time with less what we call refinements or fine tunings.
I wonder too so since you have fewer patients coming into the office for social distancing and safety reasons, I wonder if some of these virtual interactions can also make up for that lack of patients. I think about, small business, you really need to make sure that you're maintaining the same number of clients, so then you could support your staff and make sure that they can stay employed. So hearing that you're going to have to cut down your patients in the chairs, potentially 10%, that's a lot, or cut it all the way, cut it all the way back. Like, so you were only seeing maybe 10% of what you were seeing. So I'm wondering if virtual interface can sort of make up for one of those gaps. So even though you're not seeing as many people in person, that's okay as long as you can make up for it virtually. And do you think that is going to happen, or are you still concerned about?
No, I feel that that's going to happen. That's what we're hoping. That's what we're banking on. We have 2 staff members who have been identified as dental monitoring coordinators, DMCs, and they're right now, all they're doing is analyzing the pictures that are coming in, bringing them to my attention. We discuss it, and then they get back to those patients. So we're trying to keep in touch with all the patients that we hadn't been able to in 8 weeks, and identify the ones that can go out a little further versus the ones that have to be seen right away.
That's great. It sounds like, you're able to really catch up with patients more and make sure that their needs are being met, whether they like it or not.
Right. There are some that are going to love it, and there's some that were going to want to come in right away.
Right.
But we had a soft opening this week just as a trial to see how everything would go, just seeing 1 patient per hour. June 1st, we're going to, instead of only having 1 chair running, we're going to have 4 chairs running. And we're going to do it. I'm going to work from 7:30 to 7:30. So not only are we seeing less patients, but in order to get to a certain number, I have to, instead of work 8 hours, I'm going to work 12 hours. and
Right.
I'm going to do that with my associate alternating every other day. So if I
Okay.
work the long shift on Monday and Wednesday, he'll work the long shift on Tuesday and Thursday, and then we'll have a regular Friday, and we
Mm-hmm.
can calculate, how many patients we're going to see during that week. And
Mm-hmm.
our teams will rotate. We'll have 3 teams, and they'll rotate an early shift and a late shift on the long day and a regular shift on the regular day. And my
Okay.
associate and I will flip flop so we don't burn out. But we're planning to do that for the month of June and see where we are. Hopefully, we can go back to regular hours come July if we've sort of caught up with all the patients that we hadn't gotten to see. To your point,
Mm-hmm.
the new norm is not going to allow us to work like we used to. So
Right.
longer days is one way that we can make up a little for that.
Right, right. Well, I mean, in terms of a patient, that could possibly be a good thing because then they're like, oh, I have a longer range of time that I can choose from.
Right.
Though I wonder too, is it going to be more challenging to make an appointment? Are you going to have fewer time slots open to accommodate patients for maybe whatever their peak time is or whatever your typical peak time is? They might just be assigned a time. How do you think that's going to work in terms of scheduling? Are you going to have flexibility with scheduling, or is it sort of like, well, first come, first serve?
Right.
We'll see
Well,
how
I
it
had
goes.
100 patients, at least 100 patients that were on a list that had something broken. They
Wow.
broke a wire, they broke a bracket, they lost a retainer. So those were the patients that we saw during this soft
Mm-hmm.
opening this week and next week to
Mm-hmm.
try to get most of those patients taken care of so that June 1st, when we open, it's on the patients from March and April that hadn't been seen. So they've been working diligently this week and last week. The minute we found out when we were able to reopen again, we just started scheduling patients because we didn't want to have to schedule and then
Right.
reschedule, just guessing when we're going to be open.
Right.
That's a lot of work and then have to do it over again.
Right.
So right now, that's what we're working on, getting everybody scheduled.
Well, it sounds really promising. It sounds like, virtual orthodontics could be a really positive thing for patients, being able to move through the process a little bit more efficiently, and having that better outcome because of a higher accountability. Um, And it sounds like when you do see people in person that you're really well prepared for it. So that's great news. Is there anything that you're asking of your patients? Say, okay, when you do come in person, I expect you to have XYZ, or, please don't come if you have these issues, or like what are you hoping your patients are going to be doing when they do come into the office?
Well, one of the things that we took away was our toothbrush station. So we have
Mm-hmm.
disposable brushes and toothpaste available for all the patients. The old way was they would come in and sign in and brush right away, sit in the reception area, and be called back into the clinic. And
Mm-hmm.
now that we don't, we're not allowing any brushing because there's a lot of splatter.
Right.
We're asking them to do that at home, and then when we schedule their appointment, there's 6 questions that they have to answer. Do you have a cough? Do you have a fever? Have you traveled? Making sure that they're not sick to spread it. If they have answered yes to any of those questions, then we ask that we reschedule them for 14 days. But
Mm-hmm.
then the day they're here, they go get their temperature taken. They go through the same questions again just to make sure that from the time we scheduled them till the time they arrived, nothing happened, and it's still no to all of those questions.
Right.
So basically, you know, healthy, and if their teeth are clean, that's one less thing they have to do. Then when they come in, they walk to the back, they have a mask or they're provided with a mask in the office at all times, except for when I'm working on their teeth. They brush and they rinse with a 1% hydrogen peroxide rinse.
Hmm.
And it's just something that's one of these recommendations that we learned
Interesting.
online, that it's supposed to clean the mouth out and reduce the risk of germs while our assistants and our doctors are working on them. So
Uh-huh.
then they're seated in the chair and we start their appointment.
Gotcha.
The thing
So what?
about orthodontics, though, is that people should know is there's a lot less aerosol. So what
Hmm.
is it, aerosol? When we talk and when we breathe, air comes out of our mouth, carbon dioxide and particles. But if you went in for a cleaning, say, from your hygienist, and she had a Cavitron or something that's spraying air and water, and you took an image of that, it would be everywhere. So the orthodontist, what we have to do is we have to limit our aerosol procedures, which are anytime we use a high-speed handpiece, whether it's to trim and size edges or go in between and reduce the widths of the teeth to create space in crowded cases, to specific rooms that's the only thing going on in that room is one patient in one chair and nobody around them.
Okay.
So our main clinic that had the 6 chairs, but we're only using 3 with separated out, that's just normal visits where you would have a patient getting new aligners or changing an arch wire or putting some sort of activation to an appliance that they're wearing. So very little aerosol going on during that procedure.
Okay. Yeah, that makes sense.
Other than the regular breathing.
Right. Right. Are you going to have to change your cleaning practices dramatically because of this?
Yes, we definitely. It's interesting that one of the things that before we had this, we could change the mask at every single patient. We would change our mask. But now, because masks are in high demand, what they're saying we do is wear the shield over it, and you'll change your mask. Say you see a few patients at the end of the morning, put a new mask on, or if it becomes soiled, put a new mask on. But we have like belt and suspenders, so there are multiple layers. So instead of just having a mask, somebody might have on an N95 mask, which is very, very protective, but also expensive and hard to come by. So you put a level 1 mask over top of that to protect the mask.
Gotcha.
Then you put a shield over that to protect the patient and the doctor,
right,
and the staff, and you have all of these layers. So then when you're questioned about, how do you recycle this stuff? So you take your level 1 mask off they're much more available, throw that away, and there are techniques to deal with the mask, the N95 mask, where you take a Tupperware container and you put it over top of the mask and just take off the ear loops, and it sits in there, so it never got touched by hands.
Right.
And,
wow.
So there's new equipment that we have to wear and new
Tupperware
procedures that we have to wear, including Tupperware.
These are bizarre times. Well, last question. Is there anything that you want to sort of tell your patients or just our families out there that they should remember? Should they call just as frequently to come into the office, or should they, if they're worried about something, or are you suggesting, they contact you in a different way? Anything about your procedures or sort of last sort of things that you want families to know?
I would just say that safety is of utmost importance because, as I said, when we were told we could open on the 7th of May, it was a shocker. And a lot of people still haven't opened yet. And I think that's important because you only open when you feel you're ready. Right. And I feel like we've put all the safety measures that we can in place, and that like our staff and our patients and our personal safety is the most important thing. So to know that when you come in for your visit, we're going to do everything we possibly can to keep you safe. And as far as contacting us, I'd like everyone to download that My Orthodontist app so you can communicate with the office that way. We have See My Smile at Labbe Family Ortho that we have an email. We have our regular phone numbers, 410-267-7300 is our main line. And on there, you can either leave a message or push for the emergency number, and that's me, and I will either answer or call you right back. It shoots to my cell phone. So there's many ways to reach us, but know that we have a system in place where we're taking the patients that were, their appointments were on March 16th and 17th and 18th, and we're rescheduling those for June 1st, 2nd, and 3rd. and so
Gotcha.
on. And then anybody that had an emergency type of visit with a drive-by that we talked about, and their bracket is off or a wire is clipped, we're trying to get them in this week and next week as well
Hmm.
as early June. So we have plenty of systems in place. Reach out to us if you feel the need, but we will definitely be contacting you if you haven't already been rescheduled very soon.
Oh, makes sense. And then use the virtual platforms that you have. Brush
Yeah.
your teeth at home and bring a mask. Right. Those
Yes.
are the other sort of things that you're asking your patients. Well, it sounds like a really solid plan, and hopefully things will go really smoothly, both for your team and for the patients.
Thank you, Janet.
Um, well, thank you so much, Dr. Labbe, for being here with us today to answer all of our questions about how things have changed with COVID-19. Thank you to all of our viewers and listeners. Make sure that you visit ChesapeakeFamily.com for up-to-date local information on home, health, and living for today's Maryland parent. This episode will be archived on Chesapeake Family Life, both as a podcast and also as a video. I'm Janet Jefferson with Chesapeake Family Life and Third Floor Views. Thanks so much.